Hey guys, it's Robert, registered massage therapist and instructor of ligamentous articular strain technique and developer of the Ligament Pain Referral Pattern posters. Thank you so much for being here. I really appreciate the time that you guys are taking out of your life in order to watch this video on the online course for the knee. So I've got a question for you guys. Are you challenging yourself to perform at your highest ability and educate yourself with amazing information about the current evidence-informed research pertaining into mechanoreceptors, ligamentomuscular reflex, and in treatment techniques that are specific and precise in working with the knee? What are your outcomes with treating with the knees? I've actually come into contact with a lot of therapists, and I've had a lot of communication with a lot of you that are out there, and a lot of you are really fearful of the knee. Maybe in your formal education it just wasn't really explained appropriately to you guys how to specifically and precisely work with the structures of the knee. A lot of people aren't aware of the force coupling mechanisms that the meniscus go through. They're not aware of the position that the knee needs to be in order to really be specific and precise in accessing the lateral collateral ligament, the medial collateral ligament, the ACL, the PCL, the burses of the knee joint. And that's what this whole course is about. It's to get you more confident and competent in determining what structures need to be worked with in what position in order to improve the quality of life of your patients, improve their functionality of the knee and the structures below and above the knee, and to really help them return to an amazing, exciting quality of life that they knew before their injury. We have as manual therapists an amazing opportunity to play a huge role in our patients' rehabilitative format, and also to make immediate and amazing improvements in functionality and the quality of life to our patients. That's why we're here. Some of us, we've had injuries in the past. We understand the diminished quality of life that these injuries have with us, and we can really empathize with our patients, and we have this passion and this yearning in order to help them in any way possible to return back to that previous lifestyle, and that's what these courses are for. So this is an amazing opportunity for you guys because you're going to get lifetime access to all the information that I've included in this course. Also, any new information that I incorporate into my live events, I also incorporate into the online event or the online courses, and you guys get immediate access to that stuff. We run through the history, the indications, the precautions, indications. I talk to you about when and when not to use these techniques because there's always a possibility of risk of harm with certain patients. We talk about some do's and don'ts, some common mistakes about when and when not to incorporate these techniques into your practice. And I provide you some very specific and very precise detailed anatomy and palpation for the techniques so that you can ensure safety with your patients. You can go nice and slow during the treatments, and you can see some really immediate improvements in quality of life by working with the mechanoreceptors, changing them from being in a sympathetic fight or flight state to a parasympathetic resting state where they can better communicate with the central nervous system by providing more appropriate balance, coordination, kinesthetic awareness messages from the tissues to the central nervous system. That's the kind of information that I'm going to be providing you in this course, and that's the impact that I want you to have with your patients. I want you to be able to communicate in this fashion with your patients so that they fully understand why you're treating a little bit slower, you're being a little bit more specific and a little bit more precise, and what the expected outcomes are going to be post-treatment. So log on, register for the course. You'll get immediate access to all the information that's there. As a bonus, I have two patients that have knee issues. Now, these are both registered massage therapists. They're both friends of mine. They both have completely different knee issues and injuries. One is more chronic, one is more acute. You get full access to the pre and post treatment interviews, pre and post treatment assessments. I also do gait analysis from the posterior and from the lateral positions, and then I figured out how to do a side-by-side comparison at the end so that you guys can actually see the change in gait patterns from pre-treatment to post-treatment. It's absolutely amazing to have all of that documented for you guys, and the impact that it played with those two manual therapists was just absolutely a complete tipping point game changer in their rehabilitative course. That's the type of impact that I would love for you guys to have with all of your patients. So register for the course, and I will see you on the other side inside the full course. Thanks, guys.